back to my channel. For those of you who are already part of the family, for those of you who are new, welcome. My name is Kiara Selena. I'm a licensed practical nurse, and on my channel I mainly talk about nursing, but we also do a bit of beauty and hair. So today's video is going to be all about med surg. This has been a really highly requested video for me to make for a really long time now. Personally, I kind of avoided making this video because I already had a med surg vlog video that I would refer people to, but I guess I understand a little bit more why people wanted me to do more of a sit down video, because they didn't want to just watch what we do on med surg. They really wanted, you guys really wanted advice on, you know, what you guys can do in order to ensure that you guys pass and impress your teacher, and you guys really wanted to know what to expect as opposed to just kind of watching me on med surg. So if you guys want to see a med surg vlog, I will leave the link down to, the link for that down below. You guys, I'm really tired today, so I'm sorry about that. But yeah, today is going to be all about med surg, what you can expect, things you can do to make sure you pass and impress your teacher, and all of that. I was on an ortho floor, like I mentioned before, and what that basically means is that, for those of you who don't know what orthopedics is, it's basically everything that has to do with bones. So a lot of the patients that I had were people who had fractures. I had 3 patients. 2 of them had fractured their ankle and 1 had fractured her hip, and this was all during the winter. As you guys know, I live in Canada. Our winters are brutal, and sometimes you have black ice hiding under the snow you don't see, and you can slip and fall, and so people injure themselves like a lot during the winters. Like, surgical ortho floors are packed during the winter with fractures. So that's the type of floor that I was on. School works differently and every teacher is different, but if you are doing med surg, it probably means you've been in nursing school for a little while now. Med surg in most cases is not one of the first clinicals you will do. They will put you more in geriatrics, you know, maybe they might even put you in rehab. Well, personally, I did rehab before med surg, which was very similar to med surg, but they put us on more slow paced floors so that we can really start getting familiar with the charts, start like practicing our charting, you know, start getting comfortable with medications before putting us on on med surg, because your surgical rotation is really, that is like the rotation you're gonna do where you're going to feel like, you know, you're gonna start feeling like, okay, yeah, like I'm getting there. You're really gonna start feeling like you're a nurse. You're gonna be doing a lot more, and you're going to be expected to have critical thinking skills that are, you know, pretty on point, right? Once you get to that med surg stage, yeah, your critical thinking skills should start to, you know, you should start to get up there. Not saying that they expect you to be, you know, like perfect or anything. You're still a student, and even after you graduate, you're still learning. Nursing, you're always gonna learn and learn and learn. Every shift you're gonna learn something. So no one is gonna be perfect, but they don't expect you to be the same way you were on your first rotation, right? There are certain things that you should know. So on the unit that I was on, like I said, my unit was ortho, right? And with that being said, well, wound site, incision site, or whatever, was something that was really, really important for my teachers, right? Making sure that the site was clean, that it was intact, that there was no bleeding, no signs of infection. And that's probably one thing that you need to know, not only in ortho, but when anybody is post-op, an incision was most likely made. Not all the time, but if there is some type of incision, you have to make sure that you are looking for signs of infection for that wound, right? So you're checking the site, making sure that the dressing is dry and intact. You're collecting data on the amount of bleeding, because sometimes you will see blood, but you have to write how saturated the dressing was. If it was 40%, if it was 50%, if it was 80%, that's something to worry about. If it's a little dot of blood or whatever, and you know, it's 5% or 10% of blood, then that's not really something to worry too much about. I mean, it's something to note down. But if the dressing site is completely saturated in blood, then that's something to worry about. Also, looking at the skin, looking for swelling, looking for any pus, which could mean signs of infection. And guys, color temperature, sensation, movement. CTSM is so important. Like, for example, if somebody breaks their ankle, right? You want to check for pedal pulse. You want to check for temperature, right? You want to check to see if they're able to move their toes, if they're able to move their foot, if they're able to feel your hand when you touch, things like that. So those are things that you really, really need to pay attention to. Really need to pay attention to is your medications, right? Because the people that come in, they come in with their pre-existing conditions. Some people have none and some people do, right? So when you are doing your drug research, I don't know if your teachers are going to be like mine, but for me personally, we would go in, our teachers would tell us who our patients are, and then we would kind of go into those patients' charts, look at their history, look at whatever problems they have, what medications they're on, and then we would do our medication research, and then the next day we would start administering medication, right? So if you're giving medication, please make sure you pay attention to your nursing interventions. Please make sure you pay attention to your nursing interventions and stay alert, right? Make sure that you know what your norms are. Like if you take somebody's blood pressure and it's 80/40, that's not normal. Like you need to catch on to that. So make sure that you know what your norms are, because if you don't say anything to your teacher, right? And this person has hypertension, let's say they usually have high blood pressure, and now all of a sudden their blood pressure is low, but you don't catch on to the fact that their blood pressure is low because you don't know what their norms are. And then they take antihypertensives, right? And you go and you give this person their antihypertensive and now their blood pressure plummets. Well, that's a problem, because usually their blood pressure is 145 over whatever. And all of a sudden today, when you took your their blood pressure was 80/40, and then you gave them their low pressure, and now their blood pressure is like, 30 over whatever. And they're basically like, no, they're not okay at that point. You almost just killed the patient. If not, you killed the patient, right? So know what your norms are. Like, know what a normal blood pressure is. Know what a normal pulse is. Know all of these things, and then also go into their chart and see what their norm is. Because even if they say the ideal blood pressure is 120/80, not everybody's blood pressure is naturally 120/80. Me personally, I have a lower blood pressure naturally. My blood pressure will never be in the 120s. It's usually 90 over something, right? So some people just have lower blood pressure because of different reasons, right? And I naturally have a lower pulse too. I've danced my entire life, so I mean, I can go up a fleet of stairs and my pulse would probably still be 60. So, or maybe even 50, 55. That's just me, right? But know what their norm is, and know what like the regular norm is, or the average for each vital sign to give, because their blood pressure is usually high, but then you take their blood pressure today and their blood pressure is low. Don't just think, oh, well, the doctor prescribed it, so it just means that I have to give it. You don't just do whatever the doctor tells you to do, right? Like, yes, the doctor makes an order, you should follow that order, but at the same time, your license is also, well, you're not licensed yet. For us personally, we were working under the teacher's license, but if you are out there and you're like actually in the field and your license or whatever, your license is still at risk, because you're the one who's administering the drug, even though the doctor prescribed it. You're still supposed to know what to look out for. So if you know that their blood pressure is usually high and you have low pressure to give them or whatever, yes, and then you take their blood pressure today and their blood pressure is low, don't just be like, oh yeah, well, this is what they usually take. They take it all the time, so I'm just gonna give it. No, you hold it and you tell your instructor, you tell your teacher or whatever, because their blood pressure is low. Don't give them an antihypertensive drug if their blood pressure is low, even if their norm is usually high. You know what I mean? So look, keep your eyes open, stay alert. That's pretty much it I have for pharmacology. So I guess if you know the drugs that you're administering, make sure that you note down the nursing interventions for each drug. Know that if you're going to give metoprolol, that their pulse has to be 60 and above. You don't give that drug if their pulse is under 60. If you're giving an antihypertensive, make sure that their blood pressure is, you know, that is up there. I don't know what the norm is. I don't know if it says it in our nursing drug book, but check it. But make sure that you're not giving that drug if their blood pressure is low, just because it's a drug that they've been on for a long time, unless you ask your instructor or you ask whatever and they decide to give it. Then, I mean, that's kind of their problem. But then make sure that you keep your eyes open, that you stay alert, that you're looking for their urine, right? Feel on their abdomen, see if their abdomen is distended. That could mean that there's urine in there. If you feel like their abdomen is distended, go get the oh my God, bladder scan machine. Do a bladder scan and then go tell your teacher. If you want your teacher to trust you guys need to show them that they can trust you. Don't just be like, run to them for every single thing, especially if you're on med surg. Like I said, if this is your first rotation, that's different. But for me personally, I did med surg towards the very end. I think I had like two clinicals after med surg before I graduated, right? So at that point, the teacher expects me to, you know, be thinking critically, right? So don't just be like, oh yeah, the patient's, don't just feel on the patient's abdomen, see that it's distended, and then run to your teacher and be like, oh, the patient's bladder is distended. If you haven't done a bladder scan before, then don't do the bladder scan. But if you've done it before, you know how to do it, their abdomen is distended, you know, like think, what can this mean? Okay, it could mean that that their bladder is full. Let me go get the bladder scan machine, do a bladder scan, and then I can go give my instructor the information that I have. Like, okay, so the person's bladder is filled with this many cc's or this many mLs of urine, their bladder is full, and then your instructor will tell you what to do, or your teacher will tell you, okay, let's go check the protocol, let's go see what we have to do, and then we can go do a catheter or whatever. So start thinking critically, right? Instead of just running behind the teacher all the time. Because once the teacher starts seeing that, okay, yes, like, you know, her critical thinking is there, you will see that they will kind of start to back off. And personally, I don't like when my teachers are like hovering over me all the time, unless I don't know how to do something, right? Because when you feel like there's somebody watching you, it's easier for you to make mistakes because you're more nervous. So if you want your teacher to trust you and kind of give you a little bit more space, well, you have to show them that you can handle your own. Your teacher will tell you what their expectations are. Personally, before we started a clinical, we would always have a meeting. The teacher would tell us what the expectations are, would tell us, you know, exactly what it is that she's looking for, and then you can kind of work off of that, right? But that's pretty much all I have to share with you guys. Everybody's experience is going to be different, right? But surgical rotation is a surgical rotation. If you guys want a better look at exactly what it is that you guys will be doing, then I will leave a link down below to my med surg video, and I also have a video on how to ace your clinicals. So if you guys want to see that, that will also be down below. But that's pretty much all I have to share with you guys. Honestly, I did med surg over a year ago, and I don't work on a surgical unit, so I'm not really the best to give you like A1 advice, but I could tell you the little that I know, and that's what I shared with you guys today. So like I said, if you guys want to add anything, please add it down in the comment section below so that we can help each other out here. And if you guys like this video, please like and share. There may be somebody out there that needs to see this information. And if you are not yet subscribed and you want to see more content from me, don't only subscribe, please turn on your notification bell so you will be notified when I post future content. And with that being said, I hope you guys have a very blessed evening, day, night, wherever you guys are in the world. And I hope to see you guys in my next one. Much love. Bye.